In this segment, I want to talk to you about a product that I developed called CholesterEx. It's a supplement product that can help to lower blood cholesterol levels. Now, the thing about blood cholesterol is that sometimes it's affected by genetics, but in 90% of cases, people with high cholesterol, it's actually elevated because of faulty dietary and lifestyle factors and can be lowered into the normal range by making some dietary adjustments, exercising more, and in some cases taking CholesterEx, and I'm going to explain how that works in a moment. Now, before I tell you about CholesterEx, this is what I want you to know. There are some foods out there that already lower cholesterol quite spectacularly, so I want you to know what those foods are. They are different peas and beans, like chickpeas and red kidney beans and lentils are exceptionally good at helping to lower cholesterol, as well as some fruits like apples, peaches, pears, and plums. Tell me when your birthday comes is an easy way to remember that one. And 2 heaping tablespoons of ground flaxseed powder, or 1 to 2 teaspoons of psyllium husk fiber, or even using the selba grain each day, a couple of tablespoons, can help to lower your cholesterol from anywhere from 10 to 20%. That's a significant reduction, actually. So that's really where you start, as well as eating less foods that contain saturated fat and hydrogenated fats. Now, just so you understand it, the way that peas and beans and ground flaxseed and psyllium husk fiber and selba and apples, peaches, pears, and plums, the way they help to lower cholesterol is in the intestinal tract. They act like a cholesterol magnet. They actually cling to the cholesterol in the gut, drag it out of the body, so when you have a bowel movement, you're getting rid of excess cholesterol. Now, in terms of cholesterol lowering supplements, there are a number of ingredients out there that can lower cholesterol to some degree, but the best ones, the ones that are most powerful and lower cholesterol to the greatest degree, are gum google and artichoke leaf extract. I put both of them into this very potent product called CholesterEx. And what they do is they get the liver to open up the door to clear more cholesterol from the bloodstream, and then the liver dumps that cholesterol and bile acids into the intestinal tract, so you can eliminate it when you have a bowel movement. So gum google has been shown to lower cholesterol quite effectively. Artichoke leaf extract, the way that it works is by flushing more of the cholesterol and bile acids from the liver into the intestinal tract, so you can eliminate that with a bowel movement as well. So they work synergistically to give you the greatest cholesterol lowering effect. The point is that if your cholesterol is high and you're trying to get it down, then you should strongly be considering using CholesterEx every day as part of your overall lifestyle and game plan to try to get your levels into the ideal range. The truth is that independent studies show that gum google and/or artichoke leaf extract can lower your cholesterol level by 27% in many cases, and can lower triglyceride levels even by up to 30%. So these are quite effective natural ingredients. The last thing to know, and this is a question that I get all the time, is if I'm already taking a cholesterol lowering drug or a triglyceride lowering drug, or if I'm a diabetic, can I still take CholesterEx in addition to those medications that I'm taking? And the answer is yes. There's no conflict between the two. This supplement will actually help to enhance the effectiveness of some of the drugs you're taking, may enable your doctor to lower the dosage of some of those medications, because those medications often have more serious side effects, whereas the natural ingredients in here don't have an effect on causing liver damage or producing the same kind of side effects that some of the medications do. So it can complement your overall cholesterol lowering campaign. Believe me, if your cholesterol is high, you have got to get it down into the ideal range. I'd suggest that you go on to the Adiva homepage. You'll see I have an icon there called Optimal Blood Test Range. And go into that little table, and you'll see what is the ideal range of your total cholesterol, your LDL, your HDL, what the total cholesterol to HDL ratio should be, where your triglycerides ought to be, where your glucose ought to be. Those are important risk factors for cardiovascular disease, and I want to make sure you get them exactly into the ideal range for longevity and disease prevention.